So in today's video, I want to go over a lot of different things, but specifically, I want to give you numbers as to what you're going to be paying for your Part A and B card and the plans that you possibly could get, such as a Medicare Advantage plan and Plan G and high deductible G. If you don't know who I am, my name is Brian Monahan. I've been working in Medicare for the past 15 years. And what I do is I'm a broker. I'm licensed in 46 states. I help people get on Medicare supplement plans and so forth, but I also help them understand how Medicare works from A to Z. So if you're turning 65 and you're completely confused, you can give me a call and I'll help you out on how to get your Medicare card or how the Part D drug plan works, or specifically with the Medicare supplement plans, how much you're going to be paying and the different choices that you have. So let's dive into the video. So the first thing that I want to go over is when you get your Medicare A and B card, on average throughout the entire country, you're going to pay $164.90 a month to the government for this card. Everyone has to pay this. Now, there are specific reasons why someone might not be. Number one, you pay more if you're a higher income earner, and you pay less if you are a low income earner sometimes. So you'll have to take a look at that. And number two, some Advantage plans give a Part B give back, but other than that, those are only specific plans. Other than that, everyone has to pay the government something each month. And so you'll first pay that and get your Medicare A and B card. After that, you'll have to choose whether you want a Medicare Advantage plan or a Medicare Supplement plan, which I call a Medigap plan or Gap plan. Now, this is basically the first step that you'll have to take after you get your A and B card, is make this decision, because it's one that is going to be your hospital, doctor coverage, ambulance, physical therapy, MRIs, all these different things are going to be covered either under these Advantage plans or this Medicare Supplement plan, also known as the Gap plans. So how do you make this decision? Well, the numbers and the coverage are what people want to know about. So I put this up on the screen. So the first thing is, let's say you're confused about whether you want to go with the Medicare Advantage or the Gap plans. One thing is, up front, the Medicare Advantages are cheaper, but as you go, you're going to pay out. And the complaints about the Medicare Advantage plans are that there's networks and doctors, hospitals, skilled nursing centers do not have to take you. So it doesn't matter if you're on a PPO or an HMO plan. You might not be able to go to specific places. It's just like under 65 coverage with an HMO or a PPO. You might have to go to specific hospitals or doctors. That is the complaint about Advantage plans. The second complaint that I hear is that they fight people on paying certain things at times. Now, on the other side, the Medigap plans are more expensive each month, but I rarely get complaints about these plans, because if a doctor or hospital accepts Medicare, by law, they have to accept the Medicare supplement plans. Doesn't matter which one it is. I'll give you an example. There's certain skilled nursing facilities that if somebody has a stroke, they want to go to. If you have a Medicare Advantage plan that is not accepted by this skilled nursing facility, you will not be able to go. If they accept Medicare, the skilled nursing facility, they will accept any of the Medicare supplement plans, whether it be G, N, F, high deductible G. So I always tell people, beware about this when you're picking your plans. So let's go over the Medicare supplement plans first. The premiums for these plans, if you look at these three plans, I'll scroll up a little bit. You have Medicare Supplement Plan G. As of 2023, Medicare Supplement Plan F, if you weren't eligible for Medicare prior to 2020, you can't get that plan. So Plan G is the Cadillac plan, meaning it's the most comprehensive coverage for a Medigap plan. The premium on average for someone who's turning 65, I did an average throughout the entire country, is going to be $140. Now, if you think about it, it's going to be more expensive in places like New York, maybe California, Florida, different places. It's going to be least expensive where housing and so forth is also least expensive. So some people call me from different states, and it's a $100 premium, or even less than that for a Plan G. Just to let you know, I'm licensed in 46 states, so I help people throughout the entire country, whether you're in Florida, California, Texas, Kansas, wherever you are. There's only 4 states that I'm not licensed in, and I can help you wherever you live. So back to the Plan G. When you pay your premium of $140, the only other thing that you're going to pay is $226 for the deductible. Now, what does this include? This includes hospital coverage, doctor coverage, which is specialists, physical therapy, whatever it may be, skilled nursing, up to 100 days at $0 to you. It will cover it 100%. MRIs, CAT scans, that sort of thing. Ambulance. Basically, I tell people the only thing that it doesn't cover, and I'll scroll down here, is your drug plan and your dental, vision, and hearing plan. Other than that, it covers everything that Medicare itself does not take care of as far as inpatient and outpatient services. I have never gotten a complaint about the coverage on the Medicare Supplement Plan G. And I've been doing this a long time and I have a lot of clients. You will never hear someone complain about the coverage. The only complaint that they possibly could have is that the premium is either high or it's gotten high, meaning it's gone up in price. My job as a broker is to make sure that that premium is low for you. And I do that with two different ways. I'm licensed with about 30 different companies. I try to get you the best company at the lowest price. And then also, as you age, every year, I keep in touch with you and make sure that your premium is with the lowest company, or at least try to get you the lowest company and explain to you the different companies that are in your area. So that's how you keep the premium down. But other than that, the benefits, people absolutely love this plan. Now, if you take $140, multiply that by 12, and just add that deductible, your yearly cost is going to be $1,906. This is for the best coverage in the country. You will pay nothing else. If you have a stroke, a heart attack, if you're in the hospital for 6 weeks, then you go to a skilled nursing facility for 3 weeks and go back to the hospital, you're going to pay $1,906. I sometimes tell people both my parents are on a Plan G. Most of my family members, whether it be uncles or aunts or anything like that, are on a Plan G. Sometimes they're on something different because of their specific needs. Now, this goes by zip code and whether you're a male or female, so the prices are different all over the place, and so are the companies and the plans. So it's specific to where you live. But going down to the Plan N, as you see, the premium is a little bit less on average, $106. Now, I've seen this as low as $70-something for somebody who's turning 65. But in any case, you have to know, the zip code and so forth. The hospital coverage is going to be exactly the same as with the Plan G. But the difference with this plan, the big difference, is going to be you'll pay that $226, but you will pay $20, and I should have put 20 here, but I have 400. You'll pay $20, up to $20 each time you go to the doctor or the specialist or anything that's Part B. And so it could get pretty pricey. Some people, if they're going to physical therapy 3 times a week, that's $60 extra a week. Well, times that by 4, and all of a sudden you're paying more for the Plan N than you are for the Plan G. So who is this plan good for? Well, people that don't go to the doctors that much, or if you run the numbers and you think to yourself, well, the Plan G is $150 in my area, this one's $100, I'd have to spend $50 going to the doctors each month for the Plan G to be worth it more than the Plan N. There's a couple other things with the Plan N. Number one, there's an excess charge. I've explained this in a lot of my videos. Only 3% of the doctors charge an excess charge, less than 3% in the entire country. And what that is they don't accept Medicare's payment, so they tack on an extra 15% that you have to cover. But you are only covering 15% of what you would owe of the 20% that you have to cover. So it's not that much money, and I'll explain that in further detail at the end of this video. But that's why people do not like the Plan N as opposed to the Plan G. I just see most of the people that contact me are looking for G, or they're looking for a high deductible G. But Plan N is a very good plan, and I have a video that says the only 3 plans that I would get on Medicare, and they're on the screen right now. Once again, with the Plan N, it does not cover a drug plan or dental, vision, and hearing, just like the other 2 plans. The difference with the Medicare Advantage, I'll scroll up a little bit, is it does cover these different things. And so as I'm talking about the Medicare Supplement plans, the Advantage plans try to entice people with giving you dental, vision, hearing, a drug plan, sometimes a gym membership. There's 2 things about that. Number 1, some plans from certain companies, Medigap plans, will also give you these things. They'll give you a gym membership, or they'll give you dental, vision, and hearing with their plan. And so you have to look into that. I always say, yeah, if you're turning 65 or going on Medicare for the first time, call my office. You need to speak with a broker so that you can get all the ins and outs of where you live and what is actually there. Doing the research by yourself is great, but I would do the research and then contact somebody who knows Medicare and kind of ask them questions back and forth. Let's go down to the high deductible G plan. For this plan, in the last couple of years, I've gotten a lot of calls about this plan. Some of the comments that I've read, which is great. I love comments because I don't know everything about everything. And sometimes people who are on the plan for 5 years can tell you little things about the plan that maybe you didn't know about. One of the things is, it's $40 a month premium. And a lot of people have said, if in the first couple years, if you really don't go to the doctors that much and you're healthy, the maximum out of pocket, as you see, is $2,700. Now, it's $2,700. Somebody pointed out to me, you have to add in your premium. So they're right. And as I sit here, I'm talking with my hands. I hope that doesn't show up on the screen. But $40 a month, you would multiply that by 12, which would equal $480. If you maxed out this plan, you would pay that $480, but the maximum you would pay out of pocket to the hospital or doctors would be $2,700. And what happens here is, as you see, you pay 20% of everything that you do up until the $2,700. Then you're done paying. So a lot of people have pointed out, well, if I am paying $40 a month and I'm only paying $480 for the entire year, and I do nothing much for the first couple years because I'm really healthy, I'm 65, I'm young, it would take me a long time to catch up to the G plan. And it has the same benefits. It's just whether you pay up front and pay in the back. So a lot of people like this high deductible G plan. I've also mentioned in some of my other videos that there is a company, it's not in every state, but if you call my office, you can check. There's a company that if you're on the high deductible G plan, after 2 years, you can switch into a regular G plan without underwriting. This brings me into another thing that I want to talk about when it comes to the Medicare Supplement plans, GN and high deductible G versus the Medicare Advantage plan. Medicare Advantage plans, as of now, they do not have any underwriting. It doesn't matter how sick or if you just had a surgery or whatever it may be, you can get into a Medicare Advantage plan as long as it's the election period, either the annual election period or you're just starting Medicare or you have a special election period. You can always get into the Medicare Advantage plans. Might be a certain time during the year, but they don't do underwriting for people. The Medicare Supplement plans, or the Medigap plans, as you see on the screen, they do underwriting 99% of the time, which means they're going to ask you, do you have AFib? Have you had a heart attack in the last 5 years? Have you had a stroke? People say to me all the time, I have high cholesterol and I have high blood pressure. Is that going to keep me out of these plans? Absolutely not. If you're taking one cholesterol drug and one high blood pressure drug, or maybe you're taking a levothyroxine for your thyroid, these are not big deals as far in the medical world. This is just you take a pill and you're okay. they're not going to keep you out of the plan. But if something major were to happen to you, then you're not going to get into one of these plans. And as I said before, with the comments from my video that I have and other people that I've talked to on the phone, the biggest deal is when something major happens. And people say, they call it disadvantage plans, or they say, I loved the plan until I had to do something. Now, I did actually see in one of my videos, or in this video, something about Blue Cross. And I am originally from Philadelphia. I don't have a thick accent, Philadelphia accent, but you can tell, I think you can tell I'm from the Northeast. I am now in Florida, and like I said, I'm licensed all over the country, so I talk to people everywhere. But in Philadelphia, there is a specific Blue Cross Advantage plan that I find is fantastic. Now, number one, I happen to be from there, so I speak to a lot of people about it. And I have right now I have 65 clients on that plan. In another year, I'll probably have 165 clients on the plan. But it's different here in Florida. I don't put a lot of people, specific Advantage plans, I'll put people on, or, I don't actually say you need to go on this plan. I explain the different plans, but some people will choose an Advantage plan for different reasons. But there's some Advantage plans that are just downright bad. And so you have to be careful about that. But there are Advantage plans that are really, really good. And there's a specific Blue Cross plan in Philadelphia, if you're in the 4 or 5 counties around Philadelphia, that is absolutely great. And I put a lot of people on that plan. But for the most part, I'm looking at Medicare Supplement plans. So back to these 3 plans. Why would anyone choose one plan over the other? Well, it's specifically to the person. So what I do is I kind of go over these 3 plans with someone and say, which one, are you kind of leaning towards, or do you like? Most of the time they will say, you know what, that excess plan scares me, so I don't want plan N, or I don't want a high deductible plan. I don't want to be paying $2,000 out of pocket right away. Or they'll say, you know what, I don't want to pay $140 a month or whatever it is, because I'm very healthy. I want to start out with the high deductible G plan. Can I get that? Is that plan in my area where you can go into a G plan after 2 years? And keep in mind, if you're healthy after 2 years, that you could get on that one company, stay with that one company, or you could look at other companies. So there's so many different options. But let me scroll down here. So states that don't allow the excess charges: Connecticut, Massachusetts, Minnesota, New York, Pennsylvania, Ohio, Rhode Island, and Vermont. So if you're in one of these states, minus Minnesota and Massachusetts, let's forget about those 2. But the other ones, you should really consider an N plan, because the excess charge is not in your state. And so you wouldn't have to worry about that, even though it's less than 3% of the doctors in the country, which I think is so minimal, it's really nothing. But what I do with most people when I speak with them, explain to them Medicare Part A and B is going to cost you $164.90. It's very simple. It's brackets of what you made 2 years prior. And so you understand what you'll be paying for that. Then you go through the Medicare Advantage or the Medigap plans, figure out which one is best for you. If you go the Medicare Advantage route, you're done. You don't have to pick a drug plan, a dental, vision, and hearing plan, because it comes with those plans. If you choose a Plan G, N, or high deductible G, you're going to have to choose a drug plan. And I have a video on drug plans where you can go to Medicare.gov and look through the different drug plans. Of course, I do that for most of my clients. And I can even do a Zoom or Google Meet and show you how to do it, or send you a video of me doing it. And then the dental, vision, and hearing plans, if you go with the Medigap plan, you'll have to choose one of those. I hope this video helped. If you have a comment, please leave it below. It really helps out other people. And call my office if you have any questions for me, and we can help you out. Thanks for watching the video. I'll see you at the next one.